And on behalf of all of the Vote for Ohio Kids sponsors, please join me in thanking PNC, who generously sponsored the lunch today. Great. Now we are ready to get this show on the road. We're incredibly fortunate to have with us today Darielle Snipes as our moderator, although we're not using that word, so I'm going to strike that. She is our facilitator. She's our facilitator today. Darielle is a reporter and producer at WVIZ PBS Idea Stream in Cleveland. Darielle is going to come up here in just a moment. Darielle is an expert in communications with over 20 years of experience, and after stints as a local TV news anchor and reporters such as Detroit and Baltimore, Darielle joined Idea Stream. Perhaps most importantly, Darielle is a mother of a very mature 6-year-old, I understand, and brings that important perspective to this conversation. At Idea Stream, Darielle has put her passion and storytelling experience to use digging into Ohio's most challenging social issues, including adult literacy, infant mortality, and she continues to bring a sharp focus of public discussion to these complex issues. Darielle, I turn it over to you.
Thank you, Nick. Just get a little situated. Well, thank you, Nick. And as Nick said, I'm Darielle Snipes, and I am thrilled to be here today to facilitate this very important discussion, and with the two candidates who want to be the next governor of Ohio. Our panelists are impressive, and I will start calling them up and give you a little bit about their bios. David Mellon serves as the Dayton Market President for PNC Bank, covering a 12-county area across the Miami Valley. In addition to his busy career, he is incredibly active in the community in the area, leading large efforts in workplace development with a force on the investing in high-quality early childhood education. Michael Johnson is the president of the United Way of Greater Cincinnati, the 6th largest United Way in the United States. Prior to this role, Michael served as the president and CEO of the Boys and Girls Club of Dane County in Madison, Wisconsin. Michael is new to Ohio. He tells me he's only been here 2 months, but he is not new to these issues, as he is dedicated to his career to removing barriers so every child has the best chance at success. Alex Fisher is the president and CEO of the Columbus Partnership, a community-oriented throughout leadership group and that provides long-term vision for achieving greater economic prosperity in this region. Alex is a passionate advocate for driving improvement in education and child health. Pat Tiberi is the president and CEO of the Ohio Business Roundtable after an incredible 17-year tenure as the U.S. House of Representatives representing Central Ohio. At the BRT, Pat and his team are working in pursuit of policies that improve Ohio's competitiveness and build a workforce we want and need. Debbie Feldman is the president and CEO of Dayton Children's Hospital. Her team is focused on the relentless pursuit of optimal health for every child within their reach. Debbie also serves as the vice chair for the Ohio Children's Hospital Association and for the Preschool Promise in Dayton and Montgomery County. Please help me welcome the panelists for today. And before we call the first gubernatorial candidate up to the stage, I would like each of our panelists to give us a little reasoning behind why this topic is so important to them. We'll start with David.
Well, I just start by saying thank you really to Groundwork and the Ohio Children's Hospital Association for actually pulling this together. This is no easy task to really advance the dialogue around early childhood education. I've had the fortune of being involved in early childhood education for about 8 years. And what I know is that when we create regular access to high quality education, the learning process begins, and it's not just about learning for today, but it's learning for life. And we need to find a way to advance the dialogue. And when I hear statements around 14,000 jobs in Montgomery County in our area that are unfilled because we have a skills gap, that's an issue that the business community needs to address. And I feel we need to address it by advancing the dialogue in a little bit different way. A lot of time we talk about talent and workforce, and it's around attraction development and retention around talent. But I would suggest we need to take it one step further. We need to add another word, and that's around creation of talent. And what can we do as a business community to help create the workforce of tomorrow while we're still filling those jobs of today? And I feel very fortunate to work for an organization with PNC Bank that is committed to early childhood education. We have a $350 million foundation through Grow Up Great, where we make strategic investments in all of our markets in that early childhood education arena. So not only do we make the investments, but we also allow our employees to give back and volunteer through PNC's Grow Up Great.
All right, David, thank you. Pat?
Well, thank you for having me here today, and thank you to all the sponsors for making this happen. I wouldn't be here today if it weren't for the fact that I had a good education. First in my family to graduate from high school, first in my family to go to college, and it's been the great equalizer for me having a good education. So I'm a proud Columbus Schools graduate. In my new role here at the Ohio Business Roundtable, representing Ohio's large employers and CEO statewide group, jobs is one of the most important issues in workforce development. We have over 150,000 jobs on the Ohio Means Jobs website of open jobs paying $50,000 or more in our state that can't be filled today. And that's just the beginning. As you look at the future workforce, McKinsey did a study that 65% of elementary school kids today will be in jobs that haven't even been created yet. So we have a changing workforce as well. So investing in kids is so important for our future. Thank you for having me.
Thank you. And Debbie?
Thank you. It's just so exciting to look out and see so many of you here today who care about this issue and are all about how do we ensure that our kids do have an opportunity to thrive and grow in the state of Ohio. I've had the opportunity both at Dayton Children's and in my prior role as the county administrator of Montgomery County to see a lot of hardworking, dedicated people to these issues. And so we ask ourselves the question, why haven't we made more progress? And why, in some respects, do we continue to fall behind? And I really firmly believe it's because we have to work better together, that we have to connect these dots. We have a lot of systems, a lot of processes, but they don't all work together for the focused on our kids and their families. And so I am here today because I strongly believe that the state of Ohio can serve that role. The state of Ohio can provide leadership and can provide the guidance that we all need at the local level to be able to come together to get the support. We know what works at the local level, but we need our state to provide the support, and I'm going to say the funding, to help us make it work. So I strongly believe that the path to optimal health and self-sufficiency for all of our children is through many, many doors, and we have to work together, and so that's why I'm here. Thank you.
Well, thank you for having me here today. I'm the president and CEO of United Way of Greater Cincinnati, and we have United Ways from all over the state joining us here today. I come from Boys and Girls Clubs in Madison, Wisconsin, and I've been in this role now for about 2 months. And we believe that when you think about early childhood education, it is a significant investment that it shouldn't even be a debate. The number of resources that we need to invest in our young people all across the state of Ohio. It is really encouraging to see so many people here being involved in this process. So I want to say on behalf of all of our United Ways across the state of Ohio, we will continue to invest in early childhood education in Cincinnati. We have anybody who's been involved in the Cincinnati Preschool Promise that's here with us today. Just last year, we just passed our voters in our city passed a levy that makes sure that our young people in our region have access to early childhood education. It needs to be a priority for our state, and we're excited to be here today.
Thank you, Michael. And Alex?
Good. I'm Alex Fisher, President and CEO of the Columbus Partnership. We are relentlessly focused on growing the Central Ohio economy, and we sit in one of the most vibrant cities in the Midwest and across the country, some of the fastest job growth. But we also know that not every kid in our community, depending on their zip code, has the same opportunity. And we will not continue to grow the economy at the rates that we've grown it if we don't fix those issues, if we don't recognize the stark reality that increasingly we have a society that is not providing economic opportunity for all. So as a group of business leaders, we are joined with our mayor and our civic and government leaders in an effort called Future Ready that is focused on early childhood. We are joined to try to solve an infant mortality crisis in our community, and we're working to make sure that through Nationwide Children's Hospital, every kid has a chance to solve any problem that they might have with the best possible care here in their own community.
All right, and thank you to all our panelists for giving us that brief explanation. Now, I want to remind everyone the guidelines for today's event are in your program, and we are committed to bipartisanship, and so each candidate will appear on the stage for the same amount of time and will answer the same amount of questions. The agreed upon order was alphabetical by both candidates, and each campaign submitted the bio that I will read in a few minutes. I'm also going to ask that you hold your applause until the end of the candidates' time on stage. Again, I ask for your cooperation in making sure that we keep our commitment to nonpartisanship. And with that, I would like to welcome our first candidate, Mr. Richard Cordray. Mr. Richard Cordray is a lifelong Ohioan born and raised in Grove City. His parents dedicated their careers to working on behalf of people with disabilities and taught Richard that there's no higher calling than dedicating yourself to the service of others, a lesson Mr. Cordray has never forgotten. Mr. Cordray believes people deserve to be treated fairly and with dignity, respect, and that too often they are left behind while the system serves the special interest. That is why he is running for governor, to change the system so that it works for Ohioans and their families. Over the last 5 years, Cordray served as the first ever director of the Consumer Financial Protection Bureau, a position that he was appointed to by President Barack Obama, where he led the agency that was launched in the aftermath of the nation's financial crisis, dedicated to defending families against Wall Street and corporate abuse. Before serving as the Consumer Bureau, Cordray defended Ohioans as Attorney General. The Better Business Bureau recognized Mr. Cordray with an award for his work on behalf of the Ohio business and the consumers for greater fairness in the marketplace. Prior to serving as Attorney General, Mr. Cordray served as the Ohio Treasurer and Ohio State Representative and as Ohio's first ever Solicitor General, where he represented the state of Ohio before the U.S. Supreme Court and the Ohio Supreme Court. Mr. Cordray still lives in Grove City, Ohio, with his wife Peggy and their 2 children. Thank you for coming today, Mr. Cordray.
Thank you.
And I will ask the first question. Why do you vote for Ohio Kids?
I vote for Ohio Kids because my wife and I have twins, a boy and a girl, and as we have seen them and worked with them as they've been growing up, it makes you think immediately as you look at them in school about all the other children and wanting people to have the same opportunity you want for your own children. That's what we need to do in Ohio, and there's much that government can do to support families who are struggling, single-parent families, families with 2 working parents, trying to juggle a lot of responsibilities but still do the best by their children. And so I will stand up and fight for Ohio's kids and make sure they're a priority in terms of funding, in terms of attention, in terms of making progress, and also I'll fight for their parents and grandparents who are sometimes raising grandchildren now to make sure they have what they need to do their best for their children, which is what we all want.
Thank you. And the first question will be Pat.
Ohio has one of the worst infant mortality rates in the country, ranking 41st in the nation. We also see severe racial disparities in our state, with black babies dying at almost 3 times the rate of white babies. If elected governor, how will you work to ensure that pregnant mothers have access to prenatal care, to improve birth outcomes? And what other supports do you envision as part of your plan to ensure that more children live to their first birthday?
Thank you, Pat, for that question. This is something that we have seen, I've seen all over Ohio. We've had roundtables on this issue in several different parts of Ohio, and we're seeing incipient efforts and growing efforts, particularly by our cities, to address this problem. Ohio is one of the worst states in the nation for infant mortality. How could that be in the year 2018? How could we let that be? We need to broaden the bandwidth in the legislature and address a broader range of issues. We need to understand the social determinants of health and how that's affecting infant mortality. The fact that we are 49th in the country for infant mortality in African American families and communities is inexcusable in this state. Now, we also need to make sure we have the right interventions. We need to start with parents before they are parents. We have to start with pregnant mothers. We have to have home visits. We have to have good prenatal care. We have to have things that our legislature has not paid as much attention to as they should, and we all need to pull together and pull people together to address these issues. We need to help mothers give birth to healthy babies. We need to help them carry babies to full term. We need them to have the support they need, and then we need to support children on through early childhood and into the K through 12 system. But a lot of it starts before birth, and it starts with aggressive interventions and understanding the nature of these problems, and as I said, addressing broader issues about the social determinants of health, the effect of income inequality, the effect of stagnant wages, the effect of rising healthcare costs and lack of coverage. These are all things that contribute enormously to the problems we've seen in Ohio.
The next question will be given by Debbie.
The research is clear that healthy children do better in school and grow up to become healthy, productive adults. In Ohio, Medicaid covers more children than any other healthcare provider, nearly half of Ohio's kids. If elected governor, how will you work to ensure that children are a priority in Medicaid, including having access to the comprehensive, stable healthcare coverage they need to thrive?
That's a great question, and it's a great observation you made about the data. We have some terrific nonprofits in the state of Ohio who have brought us now convincing research and data on this issue. And I was saying backstage that you can care about children or you can care about data. And either way you get to the right answer, which is that we need to be more aggressive at intervening in early childhood. If you don't care about either children or data, I don't know what business you have being in public life at all. But here they point in the same direction. And what we know is that children need to get off to a faster start, and parents and families need more support to help them do that. Starting at K in the K through 12 is too late. Too many kids are left behind by then. 40% are coming to kindergarten not ready to learn. About 40% are coming out of 12th grade not ready for the workforce. There's a direct line correlation between the two. Now, as to Medicaid in particular, it is covering a tremendous number of people in the state of Ohio. And the Medicaid expansion, and I will give him credit, Governor Kasich showed a lot of courage bringing the Medicaid expansion to Ohio. And although it typically covers adults, it affects children and it affects families in significant ways. And the rest of the Medicaid program, of course, as you know, was originated to really cover a lot of children. And the CHIP program has been important in Ohio too, and there's ways I believe we could expand that. But we have to have good health coverage. We can't be looking to either end any of these programs or shrink them down. Budget Director Keene told us recently and gave convincing data once again that that is a good deal for Ohio, and I will fight to keep it. I've said that throughout this campaign, and I will work with the legislature, but not allow them to roll that back. And we will, in the Medicaid program, make the necessary reforms for more proactive, more preventive care, more emphasis on immunizations and vaccinations for children, more emphasis on prenatal care for mothers, so that expectant mothers, so that we can get the results we want and our children can get off to a good start. And ultimately, the dividends that pays for the future of Ohio are immense and really incalculable.
David?
Okay, we talked about data. So here's another data point. I think you touched on it a little bit. In Ohio, only 40% of kids are entering kindergarten ready to learn. And we know that those kids who start behind typically stay behind. demonstrating lower academic performance throughout school and decreased rates of post-secondary attainment and workforce readiness. So if elected governor, what are your plans to ensure that every child gets the early experiences they need to ensure they're set up for success?
Okay, and I think there's two different pieces to that answer. One is, what are you doing for children 0 through 5 pre-K, and what are you doing for children K through 12? And I would say the good news about 0 through 5 in this campaign has been that the two candidates, Mike DeWine and myself, have pretty much agreed on this issue. We both believe that early childhood intervention and quality learning programs are necessary, they're essential, and we are willing to invest more resources in that. And I've been around the state and seen some efforts that are being made at the local level to improve pre-K, universal pre-K. It's not easy to knit all of that together, but the state can play an important strategic role and leadership role and help provide resources, not just to have pre-K programs, but to have the kind of quality programs that we know are really essential for children to rise and get off to the kind of start we need them to get as they go into K through 12. But home visits and child care support for families, for working parents, and practically all parents, and great number of parents now are working parents, either single parent or two parents, and grandparents, if the opioid crisis means that grandparents are raising their grandchildren. It happens all over this state. Foster care system needs attention and needs improvement, and that is being strained right now by the opioid crisis. And then ultimately the kind of quality pre-K programs that Dayton and Cincinnati and Cuyahoga County are working on, but we need to scale up around the state. And then I would add to that, K through 12, it's not a given that if you start behind in kindergarten that you necessarily have to end up coming out behind in 12th grade. Our K through 12 system, there's a lot of great teachers who do a lot of great work that helps inspire and bring children along. But we also need, I think this is crucial, wraparound services in our schools. There's so many families for whom the logistical difficulties and the time and the understanding to get mental health services and dental service and social services of all kinds, it really defeats them. And if we can do that at the school building, if we can provide wraparound services in the schools, as is happening in some places around this state, I think that will be a crucial determinant that can help bring a lot of children forward even in their K through 12 years, and it's not a given that if they start behind, they stay behind, and we should never accept that that's a given in the state of Ohio.
Alex, you're the next one.
So if I told my neighbor that my daughter had cancer, our daughters go to college together, I would almost certainly get a hug. If I told that same neighbor that my daughter was depressed or, God forbid, suicidal, there would almost inevitably be an awkward silence. But yet, here in this great state of Ohio, 1 in 7 kids have experienced traumatic issues, before they reach first grade. We know that 50% of all adults with mental illness were diagnosed with that mental illness before they were 14. And we know the leading cause of death, second leading cause of death among teenagers is the suicide. So if you become governor, can you talk about what we need to be doing to raise and treat the issues of mental illness, to raise and treat the issues of toxic environments among our youngest and most precious Ohioans?
Yeah. Thank you, Alex, for that. And you and I have talked about this issue of how people regard physical health issues different from mental health issues. And there's been a lot of effort over the years to try to close that gap, a lot of effort around mental health parity. And it's been legislated in some respects. But if it's not actually executed on the ground, that it isn't really affecting people's lives in the way that it should. Mental health services are critical for young people. As you said, suicides, there's no question that mental health interventions can help lower the number of suicides that children engage in Ohio, and adults for that matter as well. We need to actually execute mental health parity. This is not so much an issue for the legislature now, it's an issue of funding, it's an issue of effort by the executive branch of the state government that I will have control over as the governor. We, of course, have a system in Ohio where we have state mental health work that's done, and we have local county mental health work that's done. And the state has not supported the counties as well as they might. The reimbursement system for these services right now is broken, and it is not working. And we're having a lot of small providers under a lot of economic pressure right now, and they may go out of business. I'm hearing that throughout this year, which has happened with the conversion of the payment system. But that we recognize the principle, and I think we do, that mental health matters as much as physical health, and maybe the determining factor for a lot of young people is important, but actually putting our effort and our money where our mouth is on that and actually making it work. And wraparound services will be a key way in which this can be helpful. It's mental health services that often fall through the cracks for families. It's hard enough sometimes for them to step up and agree and decide that they need mental health services for their children. But in the schools, people can be diagnosed. We can have mental health professionals there at the schools. We can make sure that they are handy and that we can see what's happening with children in the classroom and we can get what they need. That is really important, and there are ways we can do a much better job of delivering that, and we will work to do it.
And Michael.
As you know, we are here today to talk about a group of young people who cannot vote and who are too often forgotten about when there's tough decisions that need to be made around budget priorities and policy initiatives. We are excited that you are here today talking about your plans for our kids in the state. But our ultimate goal is to see these plans translated into real investments and a real sound policy. If elected governor, and this question is actually coming from a tweet that I got from school board member Ozzie Davis. He said, how will you make sure that the youngest, the most vulnerable residents in our state, particularly African-American kids and rural kids in our state, is a priority for your administration?
Thank you for that. What you're doing today is an important element in this. You're creating, you have a broad coalition, you're creating pressure on the public officials. You have both myself and my opponent here. One of us will be the next governor of this state. Legislators are hearing you. They are seeing your research. It is undeniable how important this is. And to me, the fact that this has not become a partisan issue in this campaign is really reassuring, and it gives me confidence that we can move forward. What it also tells me is that when I'm the next governor of the state, there is a very sound basis on which we can work in a bipartisan way with the General Assembly to get done the things we need to get done. And I will say that there will be 3 different looming stages of this up ahead for me. On November 7th, as the governor-elect, we will have 2 months to put together an administration. And appointments to key positions that will affect these policies are going to be important, and I invite you all to have input and input as a group into who are the kinds of leaders around Ohio who are committed to this and will help us get this done. And I'm not just talking cabinet officials, I'm talking about, as you know, many different appointments that will matter. It also matters that the administration be one where these different departments and pieces of it are not siloed from one another. Education versus mental health versus health services. You know, we need to have an administration that understands that this has to be put together. It isn't about your budget or your priorities or what you can accomplish in your annual report. It's about what we do together for the state of Ohio. Then the governor will have to present a budget to the General Assembly over the next couple of months. That will be a statement of priorities for the next 4 years. And then there will be, as you know, something of a wrestling match with the legislature over whether those priorities will be honored and upheld. And if we start with those priorities, and they will be in my budget, we will then work to make sure that they're followed through the General Assembly. And all during that time, my administration will be starting to work, not just with the legislature, but with cities, with counties, with school districts across the state, with local services who often have been mistreated, I would say, for the last 8 years. Money has been taken from local government and community services to Columbus and has not come back to the communities. And many communities, especially strapped communities, are starved for these resources. And it makes it even harder to cope with these hard problems and hard problems on top of those like the opioid epidemic in Ohio. So there is much to do. I'm ready to get to work. I realize I probably won't get a break until about this time next year, and I'm good with that. If none of you will take a break either and you'll work hard with me, we will make a lot of progress. And I appreciate the fact that you are stepping up, making your voices heard, showing us the data, and that will be, I believe, convincing to the leaders in the state of Ohio. It's certainly convincing to me.
And Mr. Cordray, too often kids' health and academic outcomes are determined by race, geographic location, or family income. If elected governor, how will you work to ensure that all kids have the equal opportunity to grow, live, and thrive and succeed in Ohio?
So I've talked a lot about this in the campaign. You know, people will say, and there's truth in it, that the economy is very good right now. We're in the 9.5 year of a 9.5 year recovery. You know, America's economy is good in many measures, such as unemployment average, which is low. The stock market average, if you're in the stock market, you're very happy right now, that average is very high. But for a lot of people across the state, when you get off the interstate and you get into our small and medium-sized communities, places where people love their quality of life, Marions and Zanesvilles and Chillicothe's and Mansfields, you know, they're also struggling. They're struggling with money that's gone to Columbus and not come back. They're struggling with the opioid epidemic. They're struggling with what they continue to see as uneven resources and uneven opportunities with the state government not spreading it out as much as they might across this state. So the social determinants of health, the people who've talked to me about that, on infant mortality and other issues, I'm persuaded that, you know, we have to work on those broad problems even as we're working on specific issues in specific areas. But we have an approach as to how we'll spread out opportunity across the state, how we will make sure each community is supported, and it will start in particular by getting local government funding back that people need just to do their basic jobs, just to provide those mental health services, let alone fight the opioid epidemic, which is an additional problem that none of us wishes we had to face, but we do. And we have been failing badly on the opioid crisis in the state of Ohio, and we deserve much better, and we're going to have to make sure that we work in partnership to provide it. But there's much of the state of Ohio that people in the bigger metro areas don't see, and there's much in the bigger metro areas that they don't see even under their nose in terms of poverty and infant mortality and other issues that are affecting our communities. And we need an administration that's going to understand that, but it's only by working together, it's only by teaming up together, sharing resources that we can get these things done effectively.
May I ask a follow-up question? Is that okay? So I just want to follow up on my question around, I would just love to hear specifically what will you do as the governor of the state, specifically for the kids who are the most challenged in our state, African American and rural kids, and some specific interventions around what you would do to make sure that they're thriving and winning like the other peers that sit in the classroom with them.
Yeah. Well, again, let me be even more specific than I've been. We need more attention to home visits in pregnancy, okay? We need more attention to prenatal care. What happens, the most expensive outcomes are premature births and the medical problems they create and the difficulties they create for mothers who are having a hard enough time coping with pregnancy if they don't have proper support systems. We need improved child care support for young parents who are trying to deal with a new child. We need improved efforts for our foster care system in this state. It's got to work better. We need universal pre-K programs, and that will require a number of these things will require an expenditure of resources, and we have to prioritize this in the budget. The good thing is we have a good budget situation in Ohio right now. We just banked a big surplus. We're already projecting a big surplus for the coming year. It's time for us to talk about what investments we need to make, and the legislature will need to work with me, and I will work with them. And you will work with us by advocating and holding their feet to the fire to make sure that we actually put the resources into this that we need. But we also need a better partnership between state and local government. You know, the state needs to work with our cities. It needs to work with our county governments. It needs to treat them fairly. It needs to stop taking their resources and taking authority away from them to Columbus and be Columbus knows all. Columbus doesn't know all. And in lots of places around the state, you'll see that different approaches need to be taken, and we can utilize that local knowledge and expertise. But these are a number of things, very specific things we can do and we need to do. And improving our education system is a whole different topic. But the failing charter schools that have pulled money out of the public schools and haven't been held accountable is another thing that's hurt us, and we will hold them accountable. Good performance is great. Poor performance needs to be remorselessly rooted out.
Thank you for that. And this will probably be the last question, but we know that factors outside of the early education and healthcare systems can have significant impact on our most vulnerable children's ability to learn and lead healthy lives. If elected governor, how will you work to address the social determinants of health and education that impact Ohio kids?
Yeah, so these are the bigger issues that I often talk about around the state because I hear from people about it, day in and day out. The kitchen table issues, the sources of anxiety for people in their economic lives, what kind of future are they going to have, worried about what kind of future their children are going to have. So on the social determinants, first thing we need to do is protect healthcare in Ohio and improve it. I have laid out our approach, which will be to keep costs down for people, to keep prescription cost prices down, to maintain the Medicaid expansion and fight for it, and work to reform and improve it with more preventive and proactive programs within the Medicaid system. We need to improve our insurance exchanges, which have not worked well in Ohio. They haven't gotten the kind of competition and choice and cost control that we should have and some other states have achieved. We need to look at the CHIP program, see where we can expand that and where that's helpful. That's a very cost-effective way of delivering health care. So that's on health care. Protect pre-existing conditions, for gosh sakes. Half of Ohio has a pre-existing condition. Why should people have to worry about they might have to lose their health coverage just because they become a higher risk? On education, there's a number of things we can do to improve K through 12 education. Wraparound services is part of it, taking off a lot of the unfunded mandates so teachers can teach children in the classroom. People can get better outcomes there. I trust our teachers. They need to be allowed to teach. The other services that are provided to children through wraparound services will matter enormously to their performance. And it'll take a lot of stress off of families. That's important. And then, above all, providing opportunity in the state and spreading it across the state so that no community is being left out or left behind. A number of ways we've talked about doing that, stepping into our future with clean energy and the jobs that will bring. Firing up our infrastructure in the state, which we know has been deferred and is overdue, and it's good jobs all across Ohio. Supporting our small and medium-sized businesses who spread all across Ohio and making sure our homegrown businesses can thrive. And getting back local government and community service money from Columbus so that can be spent and be used wisely and circulate in our communities. All of these things will help us all across Ohio. But ultimately, the governor's role is to work on these issues, but also work on the broader issues that create the kind of Ohio where we have a future, where our children will want to stay here, make their lives here, raise their families here, and that's an issue in Ohio right now. Don't kid yourselves. And that we can be a more progressive state, a more tolerant, a more welcoming, a more diverse state, and show those values both to businesses from around the country who don't want to come to an intolerant state, and also to ourselves so that our young people feel proud of this state, want to be here, and we develop a different politics with a different tone that is more inclusive, more partnering, more welcoming, and that's what Ohio, that I know, has always stood for.
Thank you, Mr. Cordray. And there are about 5 to 6 minutes left, and we're going to give you the stage to have some final statements on this topic.
Okay. I kind of thought that's what I was just doing. But if you're going to let me talk even more, I'll talk even more. So, look, I grew up here, and I talk a lot about what has led me to public service. And for me, it was the example my parents set. My mom and dad both worked with children and adults with developmental disabilities their whole careers. Every day they got up and went to work, and it was about someone else. It was about raising somebody else's quality of life. And it's the kind of public service that I think we all deep down really respect and are proud of in this state. It's the kind of work that raises the quality of life in our communities every day. And I see it all over the state. I see teachers, I see police officers and firefighters, I see first responders, I see the mental health specialists, I see the people battling the opioid crisis. Those are the people we need to respect and lift up in this state. I see a politics from Washington, coming from Washington, is very different from that. That's trying to divide us, trying to pit us against one another, that's built on blaming and scapegoating, so, as though knocking someone else's down. As I heard somebody put it the other day, that blowing out someone else's candle makes yours shine brighter. It doesn't. We know that in Ohio. It's never solved any problem to divide people and pit them against each other. When we took on the foreclosure crisis 10 years ago, people were losing their homes in this state to predatory lenders. We did that by bringing people together from the state government. I was the state treasurer. Local officials. I worked with Chief Justice Moore of the Ohio Supreme Court to do mediation in the courts. Worked with nonprofits to help loan modifications for people. Worked with the U.S. Attorney for the Northern District, a fellow named Steve Dettelbach, to actually prosecute and jail mortgage fraud people who were cheating people out of their homes. It's that kind of effort, bringing people together. We created what we called Homely Save Our Homes task forces. It wasn't in the code. It wasn't anywhere. It was something we created because we saw a problem, we needed to address it. That's the kind of leadership we need in this state. It's the kind of leadership we need on the opioid crisis. It's the kind of leadership we need going forward. And by the way, going forward, we need a check on this legislature. We can't be backwards on all these issues. We can't be backwards on clean energy. We can't be backwards on protecting the environment. We can't be backwards on reducing the gun violence. We can't be backwards on criminal justice reform. We can't be backward on equality issues, on women's rights. These are things we need to move forward on. And we need to check on that legislature. But we also need, and you embody it for me here, is the right kind of advocacy, the right kind of pressure to create bipartisan consensus on important issues that will move Ohio forward. Early childhood learning programs, early childhood intervention, children's health. There's no more critical issues than those. What you're doing here and what you do all along and what you will do with me when I'm governor and with the legislature that I'll be working with is help create the climate. And I'll need you to do it. I'm counting on you to do it. Help create the climate so that when we talk about these important things, and we will make judgments over this next year that will spill out over the next 10 or 20 years, and they'll matter enormously to the future of this state. When we make those judgments, we make them wisely, we make the right investments, we set the right priorities, we make the investments that will keep our state strong and build that next generation. And by the way, whatever we've been doing in Ohio, the upcoming generation right now, the teenagers, the people in their 20s and 30s, they all seem young to me, they are now making a difference. They're standing up and speaking out. They have voices that are voices for progress, voices for treating one another better than what the kind of politics we see from Washington, voices to say no bigotry, no intolerance, no prejudice, no stereotyping, just people working with one another. That's what I see in my children's generation, and that's what we should be doing to bring people along. And if we share leadership with this younger generation this year, we will change this state for the better, and we'll ultimately change this country for the better. And then if we all together will bring along the next generation and give them more advantages and more opportunities and recognize that that isn't true for a lot of children. A lot of families are struggling, a lot of communities are struggling in this state. If we do that, then we'll be the state we can be proud of. That's what I want us to be, that's what I hope to be, and I thank you for the time to spend with you today.
Thank you, Mr. Cordray, for coming out today. Thank you so much.
Thank you. Thanks. Thank you. Thank you. Nice job. Thanks.
And now it is time for our second candidate. Let me introduce Mike DeWine, the Republican nominee for Ohio Governor and currently Ohio's Attorney General.
Yep, good to see you, Pat. Good to see you. I'm here.
Mike DeWine cares deeply about children and families, and specifically for kids growing up in Ohio who, because of no fault of their own, simply do not have the same chances for success in life as their peers. As governor, Mike DeWine will do everything in his power to create change and provide more opportunity for those children. Mike DeWine and John Husted are ready to fight for an Ohio that works for all families. Mike DeWine has made promoting strong families and children his top priority throughout his career, including supporting health and wellness, protecting children from abuse, and backing strong schools. In the very first policy announcement of his campaign for governor, Mike DeWine rolled out his plan, Opportunity for Every Ohio Kid. The children-focused agenda will improve access and increase quality of early childhood education services, increase home visiting services for at-risk first-time mothers, and dedicate more funding to the state's foster care system, which lags behind the nation. Mr. Mike DeWine knows that the failure of Ohio's children is a tragedy that affects all of us and has a plan to ensure every Ohio child has the opportunity to live a healthy and fulfilled life, succeed in their education, and grow up to live the American dream. Mike and Fran DeWine have 8 children and 23 grandchildren and reside in Cedarville, Ohio. Welcome, Mr. DeWine. Well, my first question is, why do you vote for Ohio Kids?
Well, first of all, thank you all for inviting us here today, and thank you for all you do for children. Children can't vote, and because they cannot vote, I think it's incumbent upon us as adults to make sure in public policy that they are well represented. We're all, I think, a product of our past and kind of who we are. You just heard Fran and I have 8 children waiting for the birth in a few months of our 24th grandchild. And so, when I see kids who are in difficult situations, where my mind goes is that might have been my child, or that might be my grandchild. And so this is, so very, very important that we do what we can to help children and, frankly, make it a priority. This is really the number one reason I run for governor, is because of my passion for children and what we need to do. I started my career as a county prosecuting attorney. Actually started as an assistant county prosecutor. And literally the first case I had was a children's services case. County prosecutor represented children's services. And what I saw as a prosecutor and what happens to some children, the abuse that they suffer, frankly shaped how I look at many, many, many things. Later, I was in the state Senate. Shortly after I was elected, a little 7-year-old boy, a little boy by the name of Justin Beeson, was killed. Killed by a drunk driver, killed 8 o'clock in the morning, right in front of his school bus. In front of his school as he was getting off a bus. Grandfather came to me and said, can't you do something about the drunk driving? So I wrote the first really tough drunk driving law Ohio had, and we got it passed. And I did that really in memory of Justin Beeson, because we didn't want other families to go through that. In the United States Senate, I really spent a lot of time working on children's issues. Those of you from children's hospitals know that when I was able to get on the Appropriations Committee, I know this is a bad word today, but earmarks, but we were able to get earmarks for some of our children's hospitals and for some specific programs. Every year we battled the graduate medical education money. It seemed like it didn't make any difference whether it was a Republican or Democrat administration. They took money out and zero funded it every year, and we had to put that back in and fight for that every single year, and I did. Throughout my career, I've worked in a bipartisan way. As governor, I will work in a bipartisan way in pulling people together. I've always been good about pulling people together. A couple of examples from my tenure in the United States Senate. We went out to children's hospitals and pediatricians around the state and said, what challenges are you having? And one of the things that we heard was that when new drugs were coming on the market, new drugs were being tested, many times they were not tested for children. And because they weren't tested for children, pediatricians, frankly, did not know what the dosage should be. And so they were either over-prescribing, under-prescribing, or in many cases, they weren't doing anything at all because they were afraid to do it. And so I partnered with Chris Dodd, Democrat from Connecticut, and a series of 3 separate bills. We were able to change that. And now hundreds and hundreds of these new medicines are actually tested for kids. And so made a huge, huge difference. In regard to school safety, I worked with Jay Rockefeller, Democrat from West Virginia at the time. School bus safety. We worked on that. We worked on safety in regard to cars, particularly in regard to children. The AIDS epidemic, when I was in the Senate, was full-blown around the world. And one of the things I'm very proud of is that I worked with Democrats and Republicans alike to get more money to help moms so that they could take the medicine before the baby was born, so that the odds of that child being born addicted went down dramatically. So this is my passion. This is why I run. I know in the later questions we're going to have an opportunity to talk about some of the specific issues and things that I want to do as governor. So thank you for the question.
Thank you. And the first question from the panelists will be from Pat Tibieri.
Ohio has one of the worst infant mortality rates in the country, ranking 41st in the country. We also see severe racial disparities in our state, with black babies dying at almost 3 times the rate of white babies. If elected governor, how will you work to ensure that pregnant mothers have access to prenatal care to improve birth outcomes, and what other supports do you envision as part of your plan to ensure that more children in Ohio live to celebrate their first birthday?
Well, Pat, this is a tragedy, and we should be shocked by the numbers that we see. The numbers we see, particularly among African American children, moms. But it's not just African American, it cuts across. And it's not just in our inner cities. We see it in our Appalachian counties. We see it in some of our more affluent counties. Every single county in the state, no matter where you live, has got moms who are in that situation. I would invite you, when you leave, to take a look at what we have put forward, John Husted and I, and what we want to do when I'm governor. It's a real specific agenda. And the first initiative that we actually rolled out was our Children's Initiative. And you can, by the way, you can see that. Just go up on the web page, MikeDewine.com, and you can look at the different things that we're going to do. My experience has been the first 100 days, 120 days of an administration is when you really get moving. If you don't get moving in that time period, you're not going to really make the difference. And so we've laid out exactly what we want to do beginning January 14th. Let me just tell you about what we want to do. There are great models out there. Cincinnati Children's has a great model in regard to home visits. I don't think there's anything any more important than ramping up this program. This is a program that now covers only about 4% of the eligible families. Most of you are very familiar with the program, but the whole idea is to reach out to that mom prenatal, before the baby is born, long before the baby is born, and try to give her holistic services, help her with health, if she's on drugs, if she's smoking, if she's doing other things, to try to work with her in regard to that. And then after the baby is born, that process continues, and the more that the father can be involved as well, it's very, very, very important. John Husted and I are going to triple that program the first year. We're going to go from 4% to 12%. In dollars, that's going from $20 million to $60 million. The only thing that frankly stopped us from going further is we don't know if the capacity is there to do all of that in the first year. But there are models out there. I think that children's hospitals around the state, we are really blessed with great children's hospitals. We probably have more than virtually any state in the union, and they're good, and they make a huge difference. They're institutions that really work. So as we look at rolling this out, beyond 4% and continue. We hope to continue each year to raise that number. As I said, we'll start trying to get at first year at 12%, and then we'll just try to keep going from there. But using children's hospitals and working with children's hospitals is certainly a way that we think we can use an institution that really works and works very, very well, institutions that work and work very well.
Debbie, what is your question?
Continuing on the healthcare front, the research is clear that healthy children do better in school and grow up to be healthy, productive adults. In Ohio, Medicaid covers more children than any other healthcare provider, nearly half of Ohio's kids. If elected governor, how will you work to ensure that children are a priority in our Medicaid program, including having access to the comprehensive, stable healthcare coverage that they need to thrive?
Well, Debbie, thank you very much. Let me first say a couple things about Medicaid that are not in direct answer to your question, but I want to make it very, very, very clear. John Husted and I will continue the Medicaid expansion. We think that is very, very important. We will add to that. The governor has already sought a waiver in regard to a work requirement, but as for our able-bodied adults. But we will add to that a wellness component. A wellness component, we've made some progress in the last few years, but we have to get really, really serious about wellness for our entire Medicaid population and start early. The other thing I would mention and make sure that it's really, really clear to everyone, because there are a few ads on TV that say otherwise, but I am very dedicated and always have been very dedicated to making sure that someone who has a pre-existing illness, pre-existing medical problem, that they are able to get the coverage that they need. So that's something that I'm very, very, very much dedicated to, and we will make sure that that continues to happen. I think there's a great opportunity in regard to Medicaid, Deb, to work closer between our schools and Medicaid. We've got some great examples around the state for that's working. The Euler School, for example, in the Cincinnati area is one example. I've had the opportunity to tour the school and see the kind of the wraparound services that are available. I think we can become more creative in regard to Medicaid. Why the schools? The schools are a logical place. That's where all the children are. It's where we have the opportunity to make sure they have good medical care. It also presents, frankly, an opportunity to wrap services around these children. Mental health services are very, very important. One of the things that we have committed to do is to make sure there's a mental health specialist available to every child and every teacher in the state of Ohio. This is just very important. It's important, number one, so that we can see if a teacher sees a problem with a child, that early on we can get that child the mental health help that they need. Some of the horrible tragedies that we have seen with school shootings and other things, there were signs early on with that particular person, that particular child, and the signs many times were not paid much attention to. And so having every child in every school have access to a mental health specialist who can then refer to someone else in the community if that is what is appropriate, work with the parents. I think that is very important. It's also very important because for whatever reason, we're seeing a number of our children who are quite fragile. I think some of the saddest things that I have seen is when you hear about a 10-year-old or 11-year-old who commits suicide. There's just nothing sadder as a parent to contemplate than that. And so we want to work in that area, and again, that's the other thing that will be helped by having someone who's a mental health specialist, every child has access to that. But again, conclusion, Medicaid, we've got to be more robust. We've got to be more creative in how we use Medicaid to help and get the services directly to kids, and many times the best way to deliver those services is in the schools and make it a collaborative effort.
And the next question will be from David.
Yeah, so I'm in the business community every day talking to small business, and the number one challenge that I hear on a regular basis is filling open jobs, right? And yet less than 2% of the state budget is spent in pre-K, which I look as being that funnel that's going to fill the workforce of tomorrow. So my question is this. So in Ohio, only 40% of our kids are entering kindergarten ready to learn. And we know that these kids who start behind typically stay behind, demonstrating lower academic performance throughout school and decreased rates of post-secondary attainment and therefore workforce readiness. If elected governor, what are your plans to ensure that every child gets the experiences they need to ensure they're set up for success?
Great question. I want for every child in this state what I want for my own children and I want for my own grandchildren. And I know what you want for your children and grandchildren. And that is you want them to be happy. And you know for them to be happy, they need to find a passion in life, something that they care passionately about, that they do and that they do well. So that's my goal for every child. We want every child to graduate from high school truly college ready, or on a pathway to a career, maybe through a vocational school experience, maybe through an apprenticeship, other things. But to get there, we've got to do a better job reaching our at-risk kids. We have kids growing up in this state in very difficult circumstances. We have kids growing up in poverty. Something that I see all the time is kids who are growing up and they have one or both parents who are drug addicts. We've got children who are going into foster care because of that situation. Our foster care system is really bursting at the seams with kids. If we are to reach these kids, there has to be intervention in their life, because tragically, for many of them, if there is not an intervention in their lives, they will not be able to truly live the American dream and to do the things that we all think people should be able to do and have great opportunities. So, in addition to dramatically increasing home visits, and I won't repeat what I said, but that is essential, because what happens before that child is born directly impacts where they are when they start kindergarten, and that directly impacts where they are, where they can read by third grade, and whether they're going to graduate. So it all goes back. There's nothing more important than early childhood development. So in addition to tripling what we are doing currently in our first year in regard to these home visits, we are going to work very hard to dramatically increase the number of children who are eligible for vouchers to go to pre-K, to go into the classes, into the schools. We will increase that the first year by 20,000. We'll go from 130% poverty to 150% poverty. But the other thing that we're going to do is probably more difficult, but we're going to put a lot of resources in it and a lot of effort in it. And that is to make sure that every child who is going to a preschool situation has a school that is a high-quality school. The evidence clearly shows that if the school is not a high-quality school, that I wouldn't say we're wasting our money, but the results really come from high quality. And the high quality really goes, it covers a lot of different things, but I think the most important thing it covers is to have teachers who are well-trained, teachers who are passionate, and teachers who get the job done there. And so we currently, 80% of the children who the state is paying for to go into these schools, 80% of those children are in schools that are not high performing. So that's the first thing that we have to change. And our goal is to have every child into a high performing school. When we do that, some of these schools, it is helping not just children who are poor, it's helping other children who are there as well, because you're increasing the quality. So we're going to make a great effort to do that. Again, I would ask you to look at MikeDewine.com. We spell that out in pretty good detail, exactly what we're going to do. Let me mention one other thing that I think is should be very concerning to us, and that is the lead paint problem. Decades after we knew the problem, we still have children whose responses and whose cognitive ability has been impacted by the fact that they have lead paint poisoning. I will direct my director of health to make this a priority. We are a local government state, and most services are delivered locally. And I not only do I understand that, I think that's good, but we can help from the state level. We can be partners. And so this is an area where I intend to put a lot of emphasis and to work with our local health departments, particularly those in our urban settings where we see this problem. It's at its absolute worst. Prevention is the key. We're doing some things afterwards, but we got to get in front of this.
Alex, please ask your question.
So I'm going to come back to the topic of mental and behavioral health. If I left here today and saw a neighbor and told them that my daughter had cancer, I would almost inevitably get a hug. If I told that same neighbor that she was depressed or suicidal, there would more likely than a hug be an awkward silence. We know in this great state that 1 in 7 children have had 3 or more adverse childhood experiences that are impacting their emotional and mental well-being. We know that in this great state, 50% of all lifetime mental illnesses are diagnosed by the age of 14. And tragically, the second leading cause of death in this state among teenagers is to suicide. If elected governor, what are your plans to minimize instances of these adverse childhood experiences? And what plans do you have to bolster mental health and prevention? You talked about some of those in the schools, and love to hear other ideas and commitment to mental health.
Alex, thank you very much. This is a huge, huge problem, and as a parent, as a grandparent, it's just a very, very scary thing. We held a conference a number of months ago on this exact topic of trauma. I've looked at the numbers and I've looked at how Ohio compares with other states, and we don't compare very well. We know that statistically, the more of these incidents that a child has, the more trauma that child has, the more difficult it is for that child. So, again, to repeat, we'll have someone available, and the state will pay for it, because I think it's so very, very important that every child in the state of Ohio in school will have access to someone who is a mental health specialist. We see this. I see this a lot because of the drug problem in regard to children's services and the kids in foster care. A child who is taken out of a home, that's trauma. Even if it was the right thing to do, it's still trauma. The child is traumatized by changing that home. We've seen situations in foster care where children have been in 17, 18, 19 homes. I just cannot imagine how bad that would be for a child. So one of the things we're going to do is we're going to listen to the experts. We have a lot of experts out here, but we're going to really focus on foster care. It's one of the things I've done as Attorney General, something that I worked on when I was in the United States Senate in regard to adoption and Safe Families Act, but it's something that we're going to work on when I become governor of the state, because we have to try to minimize those adverse experiences that children have. This is not in the realm of the Attorney General, but we were able to take some settlement money, and we were able to create in Ohio on a trial basis a program that we call START. It is now in 17 different counties. And what we do it is give those counties the resources. And by the way, the only reason it's a trial basis pilot project is I didn't have enough money to do the whole state. And my commitment is when I'm governor, we will do this in the whole state. But what we do is two things. When a child is taken out of a home because a parent is an addict, we need to surge resources around that child, because that child we know has already experienced at least two traumas. So we surge in resources to that child, to help that child, and those certainly include mental health. At the same time, because it's so important, if that family can be put back together, that family should be put back together. Again, that minimizes the problems with the child. We do wraparound services for that parent. If they're willing to try to get into treatment, we get them into treatment. And that program is a program that has worked in the past and appears to be working in Ohio. We're going to double it in the Attorney General's office here shortly. We're going to make that official announcement in a few days. But when I'm governor, we're going to do that in every county of the state. Another thing that we're going to do in every county of the state, if I could just mention this, we have another pilot program. Again, it's only a pilot program because we didn't have enough money to cover the whole state. But it is to help Children's Services when a child has to be removed from a home. It is to put somebody in that Children's Services whose sole job it is to try to find where that child, the circle of that child's life, and find somebody that child can go live with who is in the area, but is also someone who has already had contact with the child. Again, that minimizes the trauma. It's a program that works very well. Sometimes they find a coach, sometimes they find a teacher, but there's putting a real emphasis on that. And so we're going to do that statewide as well. And this final comment in regard to our child welfare system and Children's Services. We are last in the union on the amount of money the state pays and puts forward in regard to these kids. We have to dramatically increase that. I've really hesitated to make specific pledges and talk about money because I'm not exactly sure what budget that we're going to be living with or what the economy is going to be when I become the governor of the state. But one area where I have promised is in regard to Children's Services. It is wrong that we are last in the union. Half of our counties, roughly, do not have a local levy. And I've often said to directors of Children's Services, my God, you don't have a levy, how do you get by? And what many of them have told me is, we don't. We really don't. So we got to fix that. We got to fix that, and we will fix that.
Michael, please ask your question.
As you know, we are here today to talk about a group of young people who can't vote, who are too often forgotten about when tough decisions, particularly around budget priorities and policy initiatives. We are excited that you are here today to talk about your plans with us for our kids in this state. But our ultimate goal is to see that these plans are translated into real investments and a real sound policy. As I shared with the other candidate, I got a tweet from a school district board member in Cincinnati, and he asked if you were elected governor, how will you make sure that the youngest, the most vulnerable residents of our state are a priority in your administration?
Well, they're going to be a priority because I'm going to say they're a priority. Look, it starts from the top. The culture of any organization, and we got great organizations represented out here, it starts from the top, and that culture has to be driven down. I will set the priority for my administration. My number one priority is children. My number one priority is early childhood development. These are things that where we know, based on evidence, that if we do A, B, C, we will get results. This is not 20 years ago or 40 years ago or 50 years ago when we did not know what was going to work. We know what works today. And so by using evidence-based programs and frankly putting the money where our mouth is, we will start making some changes. Now, it won't be as fast as I want. I'm a very impatient person, as you can ask any of my staff or ask my poor wife who's put up with me for 51 years. I want things overnight, But just on the home visits, we're going to go from 4% the first year to 12%, but that's not the end. We want to continue to grow. We also have to do this in partnership with existing organizations that are out there. And that's why I said earlier that the children's hospitals are certainly one organization, but there are many others out here who we want to work with. Let me mention something else. I am a good listener. Many things that I've gotten done throughout my career have not been my ideas. They have been ideas of someone who knew more than I did about the particular subject. But I've always told my team, go out and find people who know more than we know about this subject. And so my invitation to all of you is that when I become governor of the state, or you can start before, reach out to us. I don't know where Leanne is, Leanne Cornyn, who many of you know, but when I became Attorney General, I created a position, and that position is head of children's initiatives in the Attorney General's office. Not normally what you think of the Attorney General doing, but I'm so passionate about that. So Leanne, if she's willing to do that, will be doing that in that position when I'm the governor of the state. And so she's someone who you can get in contact, or you can get in contact with any of our team. But we will lead, but we will also seek out opinions of people like you in the room who have a specialty, who understand how things really work. I have the passion, you help us with the information, we'll get it done.
Michael, please ask your follow-up question.
So, Attorney General, can you give us a little bit more specifics around what you would do for traditionally African-American kids underperform in our state, and poor white kids in rural areas? What would you do as governor specifically to address those issues?
Great question. When I send my budget, my school funding budget up, it will have a priority for our poorest children. It will have that priority because we know for a fact that while money doesn't solve every problem, and sometimes it does not, and doesn't always mean that if you put money somewhere, something's going to happen, but we do know that poor children, disadvantaged children, take more services, take more help. And the good news is that once that happens, they can be on a level playing field. They can compete with anybody. It is not a question of, it really is a question of developing their potential and giving them the opportunity to get to the starting line. And so I look at this, we got to get them, first of all, to the starting line. And that goes back to the mom when she's pregnant with the baby. It goes to the early years. Is that child read to? Is that child getting the nutrition? All the things that you all know so very well. So in my education budget, the education budget for over 600 school districts, that will be a priority. It's one thing, though, to have ideas. It's another thing to be able to get them done. I have a proven record of getting things done. I do it by working with people. I do it by working with people of both parties. I do it by working with people who have different backgrounds. And so these things will be a priority for me. And one of the things I've always told my team is, look, there's certain calls that only the boss can make. There's certain things that only the boss can do. So when it's time to talk to legislators, and we have great respect for the state legislature, when it's time to talk to them about our budget, about things that we put in our budget that we want to keep in our budget, and we don't want them taken out of the budget, I will be very active in talking with them, because I think when people understand the importance of early childhood development, when they understand the importance of reaching our poorest children, when they understand the importance of reaching our most disadvantaged children, they come along. It's the right thing to do. But I also tell people, okay, if that's not enough for you because it's the right thing to do, let me add something else. And I'll say this to middle-class people, families, and somebody who maybe they're having a little difficult time seeing the importance of what I'm talking about. So look, how are children who are the most disadvantaged, who are the poorest children, giving them a good opportunity is good for everybody. It will increase the quality of life for everyone. It will give them a chance to be creative. It will give them a chance to live their own American dream. And because they have the chance to do that, because they have the chance to live that dream and to live up to their full potential, our state will have the chance to live up to its full potential. If we leave these kids back, we're never going to go where we want to go in Ohio. We still have too many of them. We've come a long way. We've made great progress in the last 8 years, but we now got to double down and say, look, we're serious. We're going after these kids, and we're going to work in every community to do it. And the governor is going to use the bully pulpit of the office to talk about these kids all the time.
And in an effort for nonpartisanship and giving both candidates the same amount of time, Mr. DeWine is out of time. But we would like to thank Mr. DeWine for coming here today and for our great panelists.
Again, thank you. Thank you, Scott. Thank you very much. Thank you. Good to be with you. Good to see you. Thank you very much. Thank you.